Hi class, this is Andrea Mahoney. I am here to share with you the surveillance presentation that I conducted. My focus was on a comprehensive review and healthcare initiative to increase the motor skills and communication of school-age children that are impacted by cerebral palsy in Southeast Michigan and Northwest Ohio, which is the region of the United States that I live in. So to give you a little background on cerebral palsy, it is a congenital disorder. It's a form of brain damage that occurs usually in utero or during childbirth that is caused by extenuating circumstances, either during or prior to infancy. It affects the cerebral cortex in the brain and causes paralysis and involuntary movements in various areas of the child's body. And those areas that are affected are impacted by which area of the brain is involved. So the child's muscle tone, their posture, movement, motor skills, they're all adversely impacted by this disease. And there are various disruptions that occur that are contributing factors and usually occur during gestation, such as vascular insufficiencies, decreased cerebral blood flow, decreased oxygenation, hypoperfusion. And usually what we see after birth are vascular injuries and hypoperfusion. Those are the two leading causes. So here in the United States, there are over 500,000 people diagnosed with the condition and 10,000 new cases that are diagnosed annually. So we see coexisting conditions frequently that accompany this disease, and those include visual disturbances, hearing impairment, speech impediments, various comorbidities such as heart disease and obesity. And other impairments generally noted include learning disabilities, behavioral problems, difficulty with sitting, being still, standing, bowel and bladder impairment, seizure activity. Um, and the impairment will vary from each person, and it ranges from anywhere from mild to severe. The effects of CP are not progressive, so identifying the impact of the impairment is usually able to be done quite early in a child's life. CP can be effectively managed with treatment and care when there are effective and therapeutic plans and interventions that are set into place. So Dorothea Orem self-care theory can be applied to any individual that is diagnosed with cerebral palsy. Orem described caring for oneself as a basic human need and indicated that people both want and need to maintain their own health and wellness. And with cerebral palsy, this can be quite challenging. Orem encompassed the whole human body as a whole unit and identified the mind as one and incorporated the physical, psychological, interpersonal, and social aspects into this self-care theory. And she theorized that self-reliance and self-care were promoters for positive influences in an individual's life. She further went on to define nursing as an art, a helping service, and a technology. So this theory is applicable to those affected with the disabilities, specifically cerebral palsy, related to their impacted ability to care for themselves and their need to incorporate self-care into their daily life. So when we review the epidemiological triangle, we can identify the agents as any predisposing pathological process that occurs, such as maternal infection, sepsis, vascular insufficiencies, a decreased cerebral blood flow, decreased oxygenation, hypoperfusion, or brain injuries. When we're looking at the host, we can identify any premature infant, those infants that are intrauterine growth restricted, low birth weight infants, those with susceptibility and exposure increased. And the environment can be the postpartum events that occur, the neonatal complications, those that have multiple gestations, what the mode of delivery is, and intra and extrauterine environment. So when we explore the surrounding ethical and legal issues that encompass cerebral palsy, it's important to consider the various legal implications around it. Locally, regionally, nationally, and globally, there are many strategies for developing improved cerebral palsy advancement, and these are focused around health promotion and prevention, education, employment, support systems, and community services. So I'm not going to go into all of these individual laws with you, but I just wanted to highlight that there are several laws in place under civil rights litigation, as well as educational rights, employment rights, and health insurance rights. And with the health insurance, it's important because they have an increased medical and prescription cost, especially individuals that have disabilities. So it was necessary for legislation to be enforced that addressed the barriers that prevented them from once obtaining fair health care. So The most recent that we've seen is the Affordable Health Care Act, but there are several others that were implemented prior to. And then another really important one to hit on is the economic implications of those affected by cerebral palsy, because here in the United States, medical costs are significantly higher for children that have cerebral palsy than for those without the disability. Studies here show that children with cerebral palsy pay 10 times more for health care, and those diagnosed with both cerebral palsy and an intellectual disability pay 26 times more for health care costs than their counterparts. And as I identified earlier, most children with cerebral palsy will have some type of intellectual disability as well. So they're looking at a 26 times more increase in healthcare cost than somebody without the disease. So additionally, out-of-pocket costs for these individuals is estimated to be over $1 million during their lifetime, with a combined cost to healthcare and to the individual being roughly $11.5 billion over a lifetime. So there are several organizations that provide funding for ongoing clinical research and program development. Those include the Administration of Developmental Disabilities and the U.S. Department of Education. There are also several others in place, but those are the two main promoters for identifying these problems and bringing some kind of normalcy to light. So when we look on a local, regional, and national level, I focused here locally in Michigan, and cerebral palsy is an issue that is being closely monitored with an ongoing research and development in creating assistance for those affected. At the University of Michigan Medical Center, research is focused on a couple specific areas of development. They have created assistive technologies and cognitive testing that have been developed to improve the standardized testing for children with cerebral palsy, and they have also developed cognitive tests that focus on literacy, processing speed, and attention impairment in these children. The research department is also developing outcomes to address their quality of life, their treatment options, and rehabilitation options. And they are additionally identifying changes that occur related to aging in these individuals as a primary focus of the research because of the increased risk for chronic disease and health ailments. So metabolic, such as oxygen consumption in the body and the use of glucose stores, is being researched. The University of Michigan is also working in coordination with the National Study of Cerebral Palsy Outcomes, in addition to several other organizations, to identify the contributing factors and provide optimal outcomes for these children from childhood well into adulthood. So they're creating individualized education plans that are customized in the schools here in Michigan to assist these children. They include tutoring and assistive programs that are in place to improve the quality of life. Since Michigan is very well known for its diverse weather, there are also several programs for aid that are in place to combat these added issues, such as energy bill assistance to ensure these children are not forced to encounter hot summer days or cold winters if their parents are unable to pay utility bills. They have camps specific to children with disabilities to combat social issues and improve physical activity. They have support groups to assist with mental stigmas and psychosocial challenges. And there are also financial assistance programs in place, such as the Medicaid and Medicare and Supplemental Nutrition Assistance Program, which most people know as SNAP. So the Children's Health Insurance Plan, which is known as CHIP, and the Women's Health and Children's Supplemental Nutrition Program, known as WIC, are also widely utilized here. The National Institute for Health is also responsible for assisting with initiatives that are government sponsored to assist with research development and funding for ongoing studies related to cerebral palsy. So, and when we look at Ohio, because I live right here on the border, so both states are very close to me. In Ohio, the Ohio Department of Education works with families to assist with ensuring the rights of children with cerebral palsy are protected, and they enforce state and federal laws heavily here. So they also provide resources and education to those impacted families and guide them to the proper sources that they may need to help them. The Ohio Coalition for the Education of Children with Disabilities works as a nonprofit organization, and they are committed to the advancement of education and quality of life improvement with children affected by cerebral palsy. And additionally, there are child and youth law programs that provide assistance with law representation and ensure that education and healthcare is obtained by these individuals. So they enforce the laws that are already in place. So, cerebral palsy is the most common motor disability in childhood. There have been several studies that have been conducted globally that indicate the prevalence of CP that ranges between 1 to 4 cases out of every 1,000 live births in developed countries. It is higher in undeveloped countries. In the United States, there are 1 in every 323 children that are diagnosed with CP. The Autism and Developmental Disabilities Monitoring is an organization that tracks the incidence and prevalence of CP throughout the United States. And through this tracking, children 8 years old and less have been identified to be more common in males than females as diagnosed with CP, and more common among Black children than white children, and equally prevalent in Hispanics and whites. Spastic CP is identified in 77% of cases, with over 58% of those diagnosed having an ability to walk independently, which is great. Reports also indicate that varying degrees of mental retardation occur in 30 to 50% of these cases, and there are reports that indicate that there are 15 to 60% of those diagnosed who will diagnose seizures or epilepsy, with a higher prevalence in those children with mental retardation or spastic CP. 31% of those affected will require the use of assistive devices such as walkers and wheelchairs in their lifetime, with a combined total of 41% having a limited ability to walk, run, or crawl. 58% of these will be able to walk independently, and 30% of those cases will not have any ability to walk. And there are several contributing factors to cerebral palsy. The prevalence increases with low birth weight children. It increases to 6.2 per 1,000 live births in comparison to those infants that weigh 2,500 grams or more. Then it decreases to 1 per every 1,000 live births. Prematurity is a contributing factor, with 35 to 79 per every 1,000 live births that are diagnosed between 28 to 31 weeks of gestation, and between 1 to 1.7 per 1,000 live births for those born at 37 weeks gestation or later. And compared to single pregnancies, studies show that those pregnancies that carry multiples are 5 times more likely to have an infant diagnosed with CP, and in vitro fertilization has also been identified as a risk factor, with those infants 1.6 times more likely to be diagnosed with CP. Prenatal injury is responsible for 70% of all CP cases, and birth injuries and malpractice are accountable for 20%, with only 10% of those cases as results of damage to the brain after birth. Maternal infection during pregnancy, trauma, jaundice that's left untreated, asphyxiation during childbirth or in utero, placental abruption, choking, near drowning, brain bleeds, these are all identified as CP risk factors. So it is very important for parents to be cognizant of the identification of their infant not reaching developmental milestones at the appropriate times, because common clinical symptoms that can be red flags that there may be an underlying disorder include involuntary movements, drooling, an inability to suck or swallow, choking while eating, having stiff muscles, having uncoordinated movements or an inability to maintain posture or gait, seizure activity, incontinence issues, or delayed motor skills. Once developmental delays have been identified, usually between 18 months to 5 years old, diagnostic testing can be used to establish a confirmation of diagnosis. So they use observational testing in coordination with imaging testing, such as MRIs, CTs, EEGs, or cranial ultrasounds, that can be used by a CP specialist to begin a treatment regimen. The single most important measure for successful symptom management of CP is early detection. So although treatment will be required for the lifetime of the child, it's important to prevent further cognitive and developmental delays through early observation, diagnosis, and treatment. So promoting a life that is independent as possible while improving the child's quality of life is the aim of all treatments. It is possible to improve the outcome of the child's future with therapy, medications, and in some cases surgical intervention, although this is not always the case. There's usually a multidisciplinary team that is put together to collaborate and create an optimized individual treatment plan for these kids that will include a pediatrician, a neurologist. They'll have therapists on board, such as physical, occupational, and speech, respiratory, and they'll even have nutritional specialists. In some cases, they'll bring psychologists on board for those children that develop behavioral issues or have mental health issues or struggle with any social stigmas. The World Health Organization has global health initiatives that are being implemented through agenda modification, policy and procedure, and standards of care. Health trends are continuously being monitored by this organization, and they make adjustments to the practice as necessary. Healthy People 2010 had specific objectives in place for monitoring CP that had been revised by Healthy People 2020 to include low birth rates, and the revision occurred because of the high incidence of cerebral palsy and because of it being the most common motor dysfunction causing disabilities in children. Healthy People 2010 set several objectives in place in their disability category. Its entire focus was reducing the proportion of children with cerebral palsy born at low or very low birth weights. The current proportion of children with cerebral palsy born low or very low birth weight is 50%, and their target is to get it down to 45%. So in attempting to create a healthcare initiative plan, it was important to identify that there are 5 levels that describe the physical capabilities of an individual diagnosed with CP. Fully independent individuals are a level 1 who only show minimal symptoms. Those people who struggle with balance and cannot run but can still walk independently are a level 2. When assistive devices are required, such as wheelchairs, walkers, or cane, then the child is diagnosed as a level 3. Once the ability to walk is completely impacted and a wheelchair is the only form of mobilization, the child is a level 4. And when all independence is gone, the child cannot sit, stand, walk independently, the child is a level 5. Motor skills can decline over time, so managing contributing factors and increasing compliance with developmental programs provided the best chance for an improved quality of life and clinical outcomes. So the clinical healthcare initiative that I focused on will be focused at maintaining and improving the child's current functional level with fine and gross motor skills and having a goal of preventing loss of current function for the best source of lifestyle improvement and overall outcomes for these children and their families. So I wanted to create a comprehensive and preventative and treatment program that focused on the child and the family as a unit with all aspects of health to be created and implemented. The focus of the healthcare initiative would be creating a year-long indoor-outdoor camp retreat for the individuals and the families. And I keep saying and the families because it's important that this is done as a unit. There'll be multiple areas of target that will be targeted, including physical, occupational therapy, psychosocial support, counseling, physical activity, exercise, educational resources, positive behaviors, promoting and directing parents to financial assistance when needed. And there will be intervention strategies that will focus on the family system to assist with stress, depression, coping, strategies, and different therapies. There will be instructional activity to include and promote skills, and more importantly, maintain the skills that they currently have. The program will be appropriate because promoting the independence of the child affected, while including the family component to assist with the dialect and interventions, will provide the best outcome for the child. Barriers to implementing a program of this nature would include financial blocks and obtaining grants and funding to get the camp set up and initiated. The target of the intervention is focused on motor skill development in childhood and sustainment through adulthood. Early childhood development will focus on physical and occupational therapies, therapeutic interventions, and personal and family community involvement. It will be critical to include the family, parents, and siblings in the process and education to ensure that learning is together and well-rounded. The plan for implementation and evaluation will include evaluating the interactional programs that will be designed to promote positive social interactions with the families and the affected children. The children historically they struggle with positive interactions, and the component will be assessed to ensure that the goal is met. So the program and its interventions will impact the lives of those with the diagnosis of CP to assist with creating a constructive outlet for therapies and assistance. The interventions will be focused on screening, evaluation, data collection, and impacted and potential individuals affected. We'll have educational interventions and regional enhancement as well. Here are my references. Thank you so much for taking the time to listen to my presentation.